You're taking your blood pressure pill every morning without fail, but nobody told you it might be quietly draining the 3 nutrients your heart needs most. You are taking your blood pressure pill every single morning. You are consistent. You are careful. You are doing exactly what your doctor told you to do. And yet something still feels off. Maybe it's the fatigue that doesn't go away even after a full night of sleep. Maybe it's the leg cramps that wake you up at 2 in the morning. Maybe it's just this vague sense that your body is not running the way it should be running. And you cannot explain it. And honestly, neither could I for a long time. I want to be upfront with you today. What I'm going to share in this video is not something that comes up in your average 15-minute doctor's appointment. Not because your doctor doesn't care, but because the system is built around managing your numbers, your blood pressure reading, your cholesterol panel, your A1C. And when those numbers look acceptable on paper, the conversation usually ends there. What doesn't get discussed is how you actually feel. And, more importantly, why. If you are over 60 and taking lisinopril, amlodipine, or any diuretic for blood pressure, stay with me. Because there is a very specific, very documented, very fixable reason why a significant number of people on these medications feel the way you might be feeling right now. Your medication may be depleting 3 nutrients that your heart literally cannot function properly without. And I want to walk you through each one, what it is, what it does, what happens when it drops, and what you can actually do about it starting this week. Let's start with the first one. Magnesium. Here's something that took me years of practice to fully appreciate. Magnesium is involved in over 300 processes in the human body. 300. But when it comes to your heart, it has one job that matters above everything else. It controls the electrical system. The signals that tell your heart when to contract, when to relax, how fast to beat, how to maintain its rhythm. Magnesium is at the center of all of it. Now here is where your blood pressure medication enters the picture. Diuretics. Medications like hydrochlorothiazide, furosemide, and others work by telling your kidneys to release more fluid from your body. That reduces the volume of blood your heart has to pump, which lowers your pressure. Effective. Proven. Widely used. But your kidneys do not sort what they flush out. When they release fluid, magnesium goes with it consistently every day. Over months and years on a diuretic, the cumulative loss can become significant. And here's the part that makes this especially tricky. A standard blood test will often show your magnesium as normal, because magnesium in your blood is only about 1% of your total body magnesium. The rest lives in your bones and your cells. So the blood number can look fine while the tissue level has quietly been dropping for a long time. What does that actually feel like? It feels like waking up tired even when you slept well. It feels like muscle cramps, especially in your calves, especially at night. It can feel like a heightened sense of anxiety or restlessness that you cannot pin to anything specific. And sometimes it feels like an occasional flutter or skipped beat in your chest that your EKG shows is minor and your doctor says not to worry about, but you notice it. Over time, chronically low magnesium has been associated in research with higher blood pressure, increased arterial stiffness, and a greater tendency toward irregular heart rhythms. This is not a fringe idea. This is in the cardiology literature. It just doesn't always make it into the exam room conversation. What can you do? First, ask your doctor to check a red blood cell magnesium test. Not just a standard serum magnesium. It gives a more accurate picture of what is actually happening inside your cells. Second, consider discussing a magnesium supplement. Magnesium glycinate is the form I most often recommend because it's gentle on the stomach and well absorbed. You can find it at Costco or Walmart for a very reasonable price. Most adults do well with 200 to 400 milligrams daily, but confirm the right dose with your own physician. Now let's talk about the second nutrient. And this one I want you to really pay attention to, potassium. Your heart is a muscle, and every muscle in your body, including your heart, depends on potassium to contract and relax in a coordinated, controlled way. Potassium also works in direct partnership with sodium to regulate fluid balance and blood pressure at the cellular level. This is actually why so many dietary guidelines for hypertension emphasize increasing potassium intake. It genuinely helps. But here's the conflict. The same diuretics that are lowering your blood pressure are also causing your kidneys to excrete potassium. This is so well recognized that there is an entire subclass of diuretics specifically designed to counteract it. They are called potassium-sparing diuretics, which tells you everything you need to know about how real this problem is. When potassium drops, and doctors call this hypokalemia, the effects on the heart can range from subtle to serious. Mild hypokalemia can cause muscle weakness, fatigue, and constipation. Moderate hypokalemia starts to affect heart rhythm in ways that show up on an EKG. And, in more significant cases, it can contribute to dangerous arrhythmias. I had a patient once, a retired contractor in his late 60s, tough guy, not a complainer, who came in because his wife made him. He had been on a diuretic for about 3 years. His blood pressure was well controlled, but he had lost almost 20 pounds without trying. He was exhausted, and he was having muscle cramps so severe he had stopped his evening walks. His potassium was low, not critically, but consistently, chronically low. We adjusted his medication, added dietary support, and within 6 weeks he told me he felt 10 years younger. He said that genuinely surprised him, because he had assumed what he was feeling was just aging. It's not always just aging. For potassium, dietary sources can go a long way. Avocados, sweet potatoes, white beans, spinach, salmon. These are all high potassium foods that are easy to incorporate into a senior-friendly diet. For some patients, a potassium supplement may be appropriate, but this is one where you really do want your doctor involved, because potassium supplementation needs to be managed carefully depending on your kidney function and what other medications you are taking. The key conversation to have is this: I've been on a diuretic for some time. Has my potassium been consistently monitored? And is my current level optimal? Not just within range, but genuinely optimal? That distinction matters. Within range and optimal are not always the same thing. All right. The third nutrient. And I saved this one for last because I think it is the most underappreciated of the three, and the one most likely to explain that deep, persistent fatigue that so many people on long-term cardiac medications describe. CoQ10. Coenzyme Q10. Let me explain what this is because it sounds more complicated than it is. Every cell in your body contains tiny structures called mitochondria. Their entire job is to produce energy, the cellular fuel that powers everything your body does. CoQ10 is an essential part of that energy production process. Without adequate CoQ10, your mitochondria cannot produce energy efficiently. Now think about which organ in your body demands the most energy, around the clock, without ever stopping. Your heart. Your heart has the highest concentration of mitochondria of any organ in your body because it needs the most energy. And it needs CoQ10 continuously to function at its best. Here is the problem. CoQ10 levels naturally decline with age. At 60, your body is producing considerably less CoQ10 than it did at 30. That alone is worth knowing. But there is a compounding factor for people on certain cardiac medications. Research has shown that some beta blockers, which are frequently prescribed alongside blood pressure medications, can reduce CoQ10 synthesis in the body. And statins, which a large percentage of people managing cardiovascular risk are also taking, have a well-documented effect on CoQ10 levels because they work through a biochemical pathway that CoQ10 also uses. So if you are over 60 on a diuretic, possibly on a statin or a beta blocker as well, your CoQ10 levels may be under pressure from multiple directions simultaneously. What does low CoQ10 actually feel like? The most consistent description I hear is this: a fatigue that is different from ordinary tiredness. It is not the kind of tired that sleep fixes. It is a heaviness, a sense of low engine power. Some people describe reduced exercise tolerance. They used to walk a mile without issue, and now half a mile feels labored. Others notice that they feel mentally slower, less sharp, in ways that concern them. In several countries, Japan, Germany, Sweden, CoQ10 supplementation is actually a standard recommendation alongside certain cardiac medications. It's not a fringe supplement. It has decades of research behind it and a very strong safety profile. The form to look for is ubiquinol, spelled ubiquinol, rather than the more common ubiquinone. After about 50, the body's ability to convert ubiquinone into its active form becomes less efficient. Ubiquinol is the active form, already ready for your cells to use. Typical doses in studies range from 100 to 300 milligrams daily. You can find it at Costco, at Sam's Club, and at most major pharmacies. It is not cheap compared to basic supplements, but it is not unreasonably priced either. And, given what it supports, many cardiologists, including myself, consider it worth the conversation. As with everything we have discussed today, please bring this to your doctor before starting. Tell them what you have learned. Ask them whether it makes sense for your specific situation, your kidney function, your current medication list. An informed patient who asks good questions gets better care. That is simply true. Now, I want to step back for a moment and address something directly. Some of you watching this might be feeling a little frustrated right now, maybe even a little let down. You have been taking your medication faithfully, trusting the process, and now you are hearing that the medication itself may be contributing to how you feel. I understand that reaction, and I want to be honest with you about it. Your blood pressure medication is not the enemy. Uncontrolled hypertension is one of the leading drivers of stroke, heart failure, and kidney disease. Your medication is doing something genuinely important. The point of this video is not to create doubt about your treatment. It is to give you the complete picture so that you can take your treatment further, so that you get not just controlled numbers, but actual energy, actual quality of life, actual vitality in your 60s and 70s and beyond. Managing blood pressure is the foundation. Protecting the nutrients your heart depends on is the maintenance. Both matter. Neither replaces the other. Here is your simple action plan. 5 things. Write this down. 1. At your next doctor's visit, ask for a red blood cell magnesium test and confirm your potassium level has been checked recently. 2. Add 1 high potassium food to your daily meals this week. Avocado, sweet potato, spinach. Pick one and start there. 3. Ask your doctor about magnesium glycinate supplementation, especially if you experience leg cramps or poor sleep. 4. If you are also on a statin or beta blocker, ask specifically about CoQ10, ubiquinol form, and whether it makes sense for your situation. 5. Stay consistent with your medication timing. Same time every day. Blood pressure control depends on steady medication levels in your system, and even a daily variation of an hour or two can affect how well your numbers are managed. None of this is complicated. None of this requires expensive testing or dramatic lifestyle changes. It requires awareness, a few targeted questions, and a small amount of consistency. The people who do the best in the decades after 60 are almost never the ones with the most aggressive medical plans. They are the ones who pay attention to the details, who ask the right questions, who treat their body as something worth maintaining, not just medicating. You are here. You watched this far. That already puts you ahead. If this video was useful to you, I want you to do one thing right now. Not for me, but for yourself. Save it. Send it to someone you care about who is on blood pressure medication, because chances are they have never heard any of this either. And when you are ready, I have linked a video right here on the 5 most overlooked signs that your heart is working harder than it should be after 60. Signs that often go unnoticed for years until they become something harder to ignore. It is worth your time. Subscribe if you have not already. New videos every week. Real information. No drama. Just the conversation your heart deserves. Take care of yourself. I mean that.